We continue partial detective, and today is going to be hips. So many people come with the hip problem. Why? Because we sit a lot, we get those, we shift weights, we're standing one leg another, so it's get that unbalance. And guess what? That femoral bone is pushing more inside the socket and start elevate that hip. And also it's lost that mobility. But most of the time, we need to check our ankles too, because ankle problem, it could be cause your hip problem. Let me put this away. And what I'm doing first, I ask my client, that's the first simple test, to do squats. Go ahead and stand this way and go ahead and do squats.
Your feet straight.
Yeah, feet straight. Don't do any crazy stuff. And you see how back is rounded, and it's hard for him. He's struggling. His knees start collapsing. I think you guys see on that the camera. What I'm doing, I'm just checking right away. Is that the ankle problem, or is that the hip problem? I put this half foam roller. You can do some like little fat book, good book. So go ahead, step with your heels. Client, step with the heels, and see if you squat again.
Mm-hmm. Yes, it feels good.
And look how straight his back is now. Guess what? And I see this every time in the gym, people doing this crazy squat, the leg is collapsed. So you're not ready to load. Go ahead, get up. You're not ready to do your squat if you have a limitation in your hip or even ankle. So it's already showing to me something going on. And like I said, if people shows up in my office and they're gonna say, "Oh, I got that hip limitation or pain," I'm not just lay down on my back and I'm gonna do therapy on you. I want to know what I'm dealing with. And the next one, it's my favorite test. It's called Thomas test. What I'm say to do to client: sit down a tiny bit on the edge of the table. No need to sit too deep. And I help him out. I roll him down. Get that knee up, both knee up. So he's holding that knee. I usually stay up there, and I ask him to drop one leg down. And I look how he's acting. Look at this, how this in the air. You see that one? And look, I push it, and it comes up right away. So what's this telling me? That quadriceps muscle or that hip flexors is get the problem. It have to be more than 120 degrees. So this is 90 degrees. If you look at this position, not the 90, it's the 180. So we want to drop this a little bit down. It have to be right in there. Plus, look at that foot. Look at that foot is like in the air right there. So the whole kinetic line is pulling. Something is happening. So it's not just the ankle. It could be the hip too. So let's switch. Get this one first. Stay neutral. Neutral, it's mean the head back. So he don't need to lean forward. And he dropped that one. And look at that one. This one is even worse. And it's come to the side. So that's mean hip flexors, the bone is not allowed him to do that movements, and that's what we need to pay attention for. Go ahead, lay down, face up, turn this way. Yeah, just like that. So here we go. I always educate my client what to do, how to get up, how to move, because this is important to do. Educate your client. That's what we're looking for, education. And what we're doing here, we also, I forgot to measure that hips when he's standing. So I usually come up and find those anterior sacroiliac bone and see the level, if they leveled or not. And most of the time, it's not going to be leveled. He's already on the table. We're going to skip that one. We had so many times to all different other video. Check it out. So what I'm doing here, I'm also check that this way. Let me get this camera actually right in action, so you can see what exactly we're doing here. So here we go. All right, so it's already telling me something going on with the ankle, with the hip. So I'm going to treat the whole thing. I'm not just going to treat that hip. So first, I'm retest the ankle. Remember, that one was worse, right? Mm-hmm. Which one is it you feel it's worse for you? Like your right one is worse for him. Yeah, you see, sometimes people think one thing, but Trust me, it's completely different. I come up, bring this in 90 degrees. I'm checking this ankle and relationship with this tibia. So, and the knee. I'm pull it in, and it's like 2 degrees. Have to be 15, 20-ish. It's good. Outside, yeah, outside is moving. It's good. Now hip, it have to be 35 degrees. Internal rotation, because we rotate that hip in. And this, when you rotate your foot inside, it's external rotation. So internal, short. It's probably like 20. Inside, it's 30, 35-ish. It's not that bad. So internal rotation of the hip is get worse. Let's check the other one. Of course, I have to go to opposite side and do opposite side. This one is really good, actually. You see, he said this is worse. But how? If I can see he's doing this 40 degrees without any problems, and that limited. Yeah, that's super limited. Ankle, actually, this is work better than that one. But it's limited both ankles. So what we're doing here, we're going to treat that ankle. We're going to treat that hip. Of course, we have to start work with our ankle first. Which one? Because we don't have much time. Yeah, let's treat the one ankle, which is going to be the right one, and both hip. So what we're going to do, let me get that, because I really want to get this idea what exactly we're doing here. Ankle. And we show so much video about ankle mobility. But what I'm doing here, I get that calcaneus bone and that tibia. It's right in here. This is, talus bone and that calcaneus. We want to get that movements. And I usually cover with a sheet. My 2 thumb is coming right in that space. I want to find it exactly when you do dorsiflex.
Hard for me.
You find that, yeah, it's hard for him, of course. We can do the bands too. Let me get that bands. Everything is around. I don't want my client just like, hanging up there. It's most people, they want to just hanging out up there, and you do the things for them. But what I love to do, and it's going to be more effective and more progressive for the clients, if I start doing bands and the fit ball. Usually I put the fit ball right here. Yeah, he can squeeze that, whatever. So what I'm doing here first, I'm start dorsiflex, get that more space. You see, I'm leaning forward. My hands is straight.
That's good.
Sometimes when you apply the pressure a little bit up there in this area, it's very sensitive. People say, oh, it's painful. Yes, because it's inflammation. Arthritis also for older folks. So I get a little bit more action now. I can feel it. I can feel I move it. So what I want to do, I want to mobilize that ankle. Ankle and the foot too. What I'm doing here, I grab that first lateral part of not the lateral, the medial part of the foot. So let's say I split the foot on the two fingers, right, like this, 2 thumbs on the top, and I'm just working the medial part of the foot. So what I'm doing, I push it in and mobilize it.
That's amazing.
It feels amazing. It's supposed to feel amazing because we start get that action in that ankle. We start moving that stuff around. Good. You see, I can do single metatarsal. I do big toe right now. Middle. Move around. I love to do that twist. So I grab that top of the ankle. Let's say my right is coming on the top, left one in the bottom. So I'm doing this in all different directions. See what I'm doing here? It's like that movements. It's like you try to squeeze. You like, when your towel is get wet, you try to like squeeze, but you go in different directions. You can mobilize that. Make sure it's no client pain. Here we go. Something just click. Come back. I love to do this. Grab the whole foot. My thumb is on the back, both of them. I grab that whole foot. You see my back is straight. I'm load myself. I'm not rounded. I'm just start pulling very gently. Some people start getting restricted. They think I'm going to pull too hard. I'm explaining. I'm just going to pull. If any pain, you let me know, okay?
Yeah, that's good.
Feels good.
It feels like I got compressed in there.
Yeah, and you don't need to do this. Some people I see that they do this like a trust adjustment for the chiropractor. We're not a chiropractor, so don't do that. If this is pop and natural, it will pop. Especially on a person like me, I'm 235 now. Oh, I dropped 5 pounds. But if I'm lean, you see, I will pop that ankle. But like I said, no need to push too hard. No need to use your force. Remember, force, you can damage person if you use too much force. So let it be, let person feel. Look at that. Foot is moving perfectly. What's next? Maybe that some muscle is restricted. So what I'm doing here, we're just going to treat one ankle.
Okay.
I'm doing this band. I put that band, he spread that legs a little bit wider, and what he's doing, he just do that wiper, and I help him out. Yes. It's also work from your hip, his glutes get active. Here we go. What I'm teaching him. Exactly. And feel that click? Hey, it just pop. It just pop naturally.
Yeah.
See, he tried to cheat. He started to drop that band inside, spread it out. Yeah, why not?
It's a little weak.
Weak, yeah. Which one is a weak?
This is weak.
He feel that weak. So that's what I'm helping him. Let's do one. Let's just do one leg. You see, he struggle. I help him out.
Oh, wow.
Practice. And people what they do most of the time, they like, oh, that's okay, we just add extra day in our therapy so you can do this for me. No, I'm not going to do this for you. I mean, I can do it for you, but it's not going to be beneficial. You want to do this every day to feel you corrected. Great. Next one, you can do dorsiflex and plantar flex. Give it to the clients and tell them, don't put towards your face. Hold it. Don't stay on that way too, because sometimes they let it go. And what he's doing, correct. Raise it up a little bit. Here we go. Dorsiflex. At the same time, you can work on that tibialis muscle right in here. Release that. You can work still on this area too. You see, you can get this right between legs and pull that area. Which one? Tell me. You can explain it to me.
This is for many, many years.
Uh-huh.
Right here.
So he feel right in here.
That's something happened.
Something happened in there. That's always ask and tell your clients, please share your experience. What do you feel? You want to know what he feels. You can see sometimes the problem, but if it's not visible, for me, I have to ask him. So what he's doing here, I'm holding it. I can apply the pressure. Good. And like I said, don't let them, just sometimes people let it go the band, they're going to slap you. So it's okay if they slap you on the hands, but if you don't, some people say, I say doing this. No, don't do that. It's going to slap you right in the face, and I saw that happening. You want a more action, get another band. Get that long band and give him work more. No. You just be up there. Don't worry, you're not going to lose it because mine on the top.
Right. Oh,
Here we go. Yeah. So I'm come up right here and pull that one and look at that. Keep working. And if he's not doing it, get that electroshock and shock him so he start doing it. Yeah. Yeah, or some like, I don't know, like a lighter. Do I have lighter? No, I don't have lighter. Sometimes I do cupping, but yeah, you can light up that foot. So he's gonna do it.
So,
This was joke. Don't do that. Okay.
so do you think this is weak, this ankle?
Yeah. Let's see a little bit more work.
Should be able to go more, right?
Yeah. You do it, and look at that. I can feel that muscle. There we go. And let it go. Let it go. Sometimes you do feel that duck leg when person lay down, and he's not exactly. So the foot is like on the side. It's called dog foot. So what's that mean? That muscle, the crotch muscle, the thigh muscles get weak, and muscle like glutes is external rotate. Yeah. So this is what I'm doing usually. In this case, I come up here. Which one I should show it to you? Yeah, I'll show you on that one.
Yeah.
So what I'm doing here, I'm not use the knee area. I come up just above the knee, under the knee, above, not below. You can do below too, actually. So you come on right here, you grab. You see my arm he's hanging that calf muscle, the whole leg. Now I come up and push on that. Let me get that ball away. So I push that inside the medial, and he's going to rotate out. Go ahead, rotate, and ask him to do this. Also great for the hip, and let it go, and you create more.
I don't have good internal rotation.
Yes, we're all going to show you that best one. You can do that. You can do above the knee, the same thing, very gently. Don't push on the knee. I see people that push knee a lot. And let it go. Okay, looks like, yeah, this one is out of space. Yeah, that 4K video is always get trouble. So, too much memory. Here we go. Try to move around, see how you feel.
Feels lighter.
It feels lighter, that's all I need. You can do flossed sometimes, but like I said, flossed is more for, let's say, younger folks, adults. Don't do this on seniors, and if any injury was present. Next one, my favorite one. We're going to come back to this. The hip. Remember, we're going to work on that hip. Sometimes I bring it on the side. Yeah, no, just you don't need to. Or you can ask the client, and you put this right between your legs. Not in your crotch. It's between your knee, a little bit above. So it's very comfortable. You can see I can distract him. I can pull him. I can just do in this back and forward. You see, I can pull that femoral bone inside that socket. But now what I'm doing here, I grab the whole leg. And you see I'm leaning. So I'm leaning in and I pull back. Do I work hard here? No. Pull in, and next one, I start do rotation. I do rotation. I pull in and rotate. Pull in, pull out, rotation. Yes, it's clicks. You can distract side to side. Yes.
Pretty good. That's good.
Pretty good. Great. Next one, to the next level, it's going to be more advanced. You're going to bring this leg to 90 degrees. I showed this many times. You come up here. This arm is coming inside under that knee right in here. That arm is coming up here, and I start distract, pull. I lean back. I lean back.
Wow, that's good.
That feels great. Pull, hold, release. Pull, hold, release. Great. Next one, I want to lean to that femoral bone inside that socket, that acetabular joints. I can put the pillow and completely lay down. My table is electric, so I can control that leveled. From here, hold for 90 seconds, around 90 seconds. I'm not going to hold 90 seconds. And I start doing rotation. Short rotation.
Wow.
Wow, 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 he said. Of course, you have to work on that quads muscle, hip flexor. And look at that. Next one, I done a lot of work up here. I want him to work too. What I'm usually do, I'm going to bring the client's legs in 90 degrees. He's going to squeeze that ball. He's squeezing that ball. Try to squeeze that ball. You squeeze, squeeze. Relax, squeeze 3 times. There we go. And next one, I'm going to get that band around that ankle. All I want you to do, just hold that legs. I'm going to pull to the side and you return to the midline. Yes, you see how struggling he is? That's fine. If he can't do it, I help him out. I show him the way. Show your brain, because the brain, that's who limited everything. It could be not just the joints limitation. Remember, we have a motor control problem. Look at that. I help him out. Now move yourself. Look at that. He started moving. You can see this on that camera, right? Perfect.
Wow.
Exactly. Wow. Let it go.
It's moving.
Moving, yeah. Let's recheck right away. Sure, why not? Let's recheck it. Is that better? A little bit. Is that better? Yes. Is that ankle moving? Yes, it's moving. I give this another like 5 degrees, and that's our key. Go ahead, scoop this way. So that's, for this camera, you're going to see this better on this one. So we're going to spend more time on that one, which was the problem. We're not going to treat the ankle. Yes, so hips only. Again, find that leg between your knees, a little bit up, above, and you start distract. So you pull. You see, you can lean back. You can hold it. You can use the band. I will show you the band exercise with that one. Distract, pull in, grab the whole leg, pull in, and start mobilize that, pull. Stick in, pull out. Stick in, pull out. We also have to check extension of the hip. Remember, he might don't have extension of the hip, which is going to be on a face down. We're going to teach him how to do distract. See, I'm lean with the whole body. That'll feel great, probably. Now, we're going to bring this one up in this position. Again, arms coming up here. Lock it in and pull out. Distract. Pull, hold. Pull and hold. You can ask the client, push towards the floor, so he resists me. He get that butt push against and resist me. Let it go. There we go. Now on the top, you see my arm, that tuning fork right here under that knee. This one is coming on the front of the knee, anterior part, and I'm lean on it and hold it up here, 90 seconds. You can do more, and you can start mobilize it. Here we go. I can feel that.
Yeah, that's a big relief.
It's a big relief, you feel it. That's all about. Next one, we do it again. We get that ball, put this in 90-90, get this knee up, squeeze the ball, raise your legs up. There we go. This is a great exercise. Squeeze the ball, squeeze the ball. He get that core muscle engaged too. Glutes, relax, squeeze again. The band is on the foot, and what I'm doing here, go ahead, pull in inside. Here we go. Look at that. And this one is better, right?
Yeah, it's a little stronger.
Little stronger. Here we go. Exactly. The weakness, that muscle is not turned on, and that's what they cause that disbalance of that hip. Let me help him out. Always help your client in the beginning. Don't make him struggle. And let it go. This is another one. Remember, we have a bands. Go ahead and let's get this double band, because it's all different density of the band. This is probably going to be double. So I put the double straps together, get this inside, raise that knee up. And what I'm doing here, go that little bit more bikini line. Actually, we can start with the knee. So it's up on the knee right now. And what I want to ask him to do, just start pushing in and out. Push in and out. Too much? Too much for client? Yes, I understand. Some clients, too much. Go ahead and step. Do one strap. Don't make your client look weak. So you help him out. Here we go. Yeah. Just think about it. If you give him one strap, he's still not going to do it. He's going to be upset. But if you help him out, he's going to start doing that. He's going to feel that progression. He's going to feel that how strong he become. Like even right now, I can feel he's coming stronger and stronger because he's activated muscle. Here we go. Yay. Now, second position, a little bit lower, all the way up to the bikini line. Ask the client if you want to adjust it. Make sure you're not jam anything up there, so you don't want that. And move. You see, I'm staying. That's why my clients bring the shorts all the time. And I'm hold it because you're weak. But if I can do different type of band, I can wrap around, I can sit it out, I can put this on that around the table. So I don't need to work hard here. Keep going. And you can do many, many exercises here. Okay, how does it feel?
That's great.
Let it go. Bowl. Remember, we get that squeeze. I put this between the knee and the leg, and I want him to squeeze and relax. Squeeze and relax. What he's activate. Don't lose. Squeeze and relax. Squeeze. Hold for like 1 Mississippi, 2 Mississippi. Relax. Squeeze again. 1, 2. Relax. Exactly. He's activating quads. He's activating hip flexors. What else do you feel it? Where do you feel it?
Calves.
Calf. He's feeling the calf. Also, do some single leg stands. When people standing on one leg, you can tell right away which is hip unbalance. Of course, measure. Remember, you have to measure. You have to see what are you working with. Some people, come inside, lay down on the table. Yeah, don't worry, I will get you. And here we go. You see, he started adjusting and let it go. You can do ball up here. Ask him to squeeze that ball this way. Resist it, pull. You can also use the band. Band, why not? Double band right here, watch. Come up here. I can hold it up here with my one leg. Ask him to bring this knee up and down. Bring towards the body. Too much? Of course. No worries. It's tough, he said. Okay. So one strap. Here we go. Now let's see how it's right now. There we go. Up and down. Up and down. Let him work. Let him work on that hip flexor now. Exactly. The hip flexor is just weak. That's what he said. But if he's going to do this for 10 days, 2 minutes, 3 minutes every day, it's going to change a lot, tremendously. Great. Also, activate the glutes, hip flexors, glutes. Yeah, this one. Place that ball right on the ankle, and I want you to squeeze and push that leg down through that floor. So this one is pushing down. He kind of tried to raise himself. If you can help him out, like doing this stuff, like rocking him, and let it go. Relax. You see, push. So he engaged his core. Push and let it go. Great. But it's many stuff you can do. But don't just work on the person. Let them do all this stuff with the bands, with the ball. Go ahead, flip face down. Let's do that hip extension. So in here, I'm supposed to be on that side, but that's absolutely fine. What I'm doing here, I place that ball right on here, on the knee. And I ask him to push down, push down. He's engaged his core. Good. And relax. See what he's doing? He's activating his glutes. Push again. And let it go. Now, I want you to squeeze your glutes. Feel your glutes. Feel, you see the glutes is not fire up. So we get some glutes. Okay, what about this way? If you do squeeze the glutes now. Push down. Here we go. So, when he's bring this leg up, the glutes is not engaged. Now think about it. If he's do all this sitting, whatever, exercising, the glutes is not engaged. The quadriceps is engaged. So let's start here. Squeeze the glutes, push down. Push down. Here we go. And glute, you see the glutes is getting engaged. The one leg is straight. So what we want to do here, what about if we put the ball up here? Squeeze up there, pull through the ground. Here we go. Here we go. Look at that. So all different positioning of the ball. Bands, I can come up here with the band, get this to the knee. Let me show you this way. Also great technique. You get this band right under that knee. You can hold in your arms. You can go under the shoulder, right in here, just like that, around my shoulder. Lift it up and ask him to, because you're not going to see it, push in through the ground. No, bend this knee and push through the ground now. Push down and up. This one is a little bit too much for him again. Yeah? That's fine. It's just hard, okay. Here we go. So just one strap then. You can lock it in that push it down and up. Here we go. Look at that. Now his glutes is working. This one is supposed to be, I have to be like somewhere here around my body. You see, and now I can hold it. Here we go, down. But if it's struggle, why just do the ball? Why just put the ball? And also, what we can do here, also work on that external internal rotation of the hip. I get that ball between knee. He's gonna jam that together. You put this up, and guess what? You can use the long band and ask him, yes, pull in and out. So external internal rotation. You see what he's doing here? There we go. Look at that. And you can hold it if you make sure he's not gonna cheat. So the foot is coming up. Let me show you on that side so you see what I'm doing here. He's holding that, he squeezed that ball. You can put the band, and here we go. So in and out. Too much, you control the band, density. Perfect. Exactly. Look at that. You see, I feel that glutes start working. Hamstring work? Why not? Get that band right here. Ask him to bring that foot towards the butt and away. Don't stay on the way. So he's doing this. You can release the band. He's doing this. Yeah. Pumping that hammy, gluteus. Go ahead. Touch the glutes. If it's not, beat him up. Beat your client up. Yeah, you can do different directions this way. Come up, down. You don't need to go too much down. You see what's happening when he's go back, he lost that control. I want him to slowly control the movements all the time. Don't be floppy here. There we go. You can help him. You can feel that hamstring. Hey, look at that. Everything is good. And that's what we're looking for. You can do all those exercises. Let's flip face up and recheck your hip. If it did anything, you always want to recheck and see how a person feel. First of all, oh yeah, I forgot the last one. This is the pubis symphysis correction, because every time that pubis symphysis, depends how we stand, that ilium is get that rotation or side bend, like rotation, side bending, we need to get that pubis symphysis back. This is the great one. You put this leg in 45 degrees. This is the 45. You get this arm and elbow between the legs. So you see my palm right on that knee and my elbow on the opposite, and I ask him to squeeze, 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 squeeze. Try to break it, try to break it, try to break it. And you just move around. Try to break again. Squeeze, 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 and rotate. Great. Next one, you want to get that glute engaged, and you teach him how to do the bridge. Go ahead, squeeze my arm, squeeze your glutes, and pull yourself back up. Push yourself up. You see how struggle he is? And you beat that glutes. Beat them up. Beat him up. Beat him up. Up, 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 up. Up, 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 and down. Squeeze. You see he's squeezing it. And you can do opposite way. You can squeeze that way and do raising up. Or he can do separation, and see he's better for him. What he's doing, he's starting to engage his glutes. That's what we'll be looking for. Okay, let it go. Let's recheck this hip now. Let it go, this one. This one is great. This one is almost there.
Wow.
Yeah. Of course, it's yeah, this one is good. This one is still need a little bit of work. But like I said, you got the idea what we're doing here. Just don't make your client like they usually say, like I said, oh, don't worry, we'll get another extra session in a week and you're just going to work for me. No, he have to feel that. He have to work. And a lot of clients, when you start doing those bands, bowl, they say, that's what they usually say. Oh, today I just want to relax today. No, he don't want to relax. He wants to activate it. That's why he struggle and in pain all the time, because the muscle is not active. He always called this tight. It's not tight tension. It's a weakness. The muscle is weak, and that's why he struggle and experience that pain. And it's so many clients like that. Don't make him suffer with the pain. Let him work. And if he said, yeah, I just want to relax, it's not my type of massage. Well, you're going to tell him. You explain him in the beginning why you're doing this, how it's a beneficial, and what they're looking for. If your client just want to relax, send them to Massage NV. If he wants to be better, feel better, be more progression, do some pain-free living, that's what's this all about, Life RX. If you want to learn more about massage, sign up with our Patreon channel, subscribe. I'll leave your comments below. And of course, ask more questions from us, because we would love to teach you. We would love to show you what we've been learning for 20 years. And now, especially with all this new AI, with all this information what's coming right now, we'll learn more. And we would like to share, we know more, and we would like to share it with you. Subscribe, sign up with our Patreon channel, a premium membership prefer. It's only $17 a month, and you will learn more and more and more. And guess what? You're going to get more beneficial to your clients. You can raise your price for your massages, make some more money, and the most important is change someone's life. Change and help someone. That's what our key is. Thanks for watching. We guys see you next week. Postural Detective.